As of 2015, diabetes impacted over 30 million people in the United States, or about 9% of the US population. More than 1 in 4 of them didn't even know they had the disease. In this video, we are going to talk about the most common types of diabetes, health effects related to the condition, and how to manage it. But first, let's discuss what this condition is. Diabetes is considered a genetic condition, even though environmental or lifestyle habits can contribute to the onset of this condition. Diabetes occurs when one's blood glucose, also called blood sugar, becomes too high. Blood glucose is the body's primary source of energy, and it comes from the food we eat. To help transfer this glucose from the food we eat to our cells, our bodies rely on the pancreas to produce a hormone known as insulin. Sometimes your body doesn't make enough or any insulin. If this occurs, the glucose from your food cannot get into your cells, so it remains in your blood. Having an excess of glucose in your blood can cause diabetes and other significant health problems such as heart disease, stroke, kidney disease, dental disease, eye problems, nerve damage, and foot problems. Unmanaged diabetes can lead to poor blood circulation, resulting in the loss of limbs and/or death. There are 3 common types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes, formerly called juvenile diabetes, occurs when one's pancreas creates little to no insulin because the body is attacking essential cells within the pancreas, the organ responsible for creating insulin. This attack results in the body's inability to create and/or use the insulin that is produced. This type of diabetes can occur at any age, but most often it occurs in children and young people. Regardless, all people with type 1 diabetes are required to have daily injections of insulin to maintain a normal glucose level. Symptoms of type 1 diabetes are similar to symptoms of other conditions and include increased thirst, increased urination, constant hunger, weight loss, blurred vision, and lethargy. In an effort to properly diagnose type 1 diabetes, a doctor must conduct a series of blood tests and monitor glucose levels after eating and after fasting. In addition, an examination of one's family medical history is also critical. Type 2 diabetes is the most common form of diabetes and primarily occurs in adults. Similar to type 1, type 2 diabetes occurs when levels of glucose in the bloodstream are too high. Unlike type 1 diabetes, people with type 2 can produce insulin, but their bodies are unable to use or process the insulin that is produced. Over time, this could lead to the body no longer being able to produce insulin at all. As I mentioned earlier, adults are more likely to develop type 2 diabetes. The risk of developing this form of diabetes increases when an individual is older than 45 years old and when they are overweight. In addition, high blood pressure and being physically inactive can also increase one's chances of developing type 2 diabetes. Just like type 1 diabetes, doctors must draw several blood samples and test for glucose levels. In addition to medication and insulin injections, managing type 2 diabetes requires one to eat healthy and balanced foods and get regular exercise. It may also be necessary to check blood glucose levels throughout the day. Gestational diabetes develops in some women when they are pregnant. Hormones that are produced by the placenta that help the baby develop also block the effects of insulin in the woman's body. This phenomenon increases blood glucose levels and can cause diabetes. After the baby's birth, this form of diabetes is likely to go away. However, having gestational diabetes increases the chances of developing type 2 diabetes later in life. It also increases the possibility of the baby being born with type 1 diabetes. Diabetes is a serious condition that can affect anyone, not exclusively people who are obese or overweight. While dietary and other environmental habits could impact the likelihood of developing diabetes, there is a strong genetic component as well. It is essential for people who have a history of diabetes in the family to talk to their doctor about being tested. This video is brought to you by PATH, Parent-to-Parent Family Voices of Connecticut. We would like to credit the American Diabetes Association, the National Institute of Diabetes and Digestive and Kidney Diseases, and the Hormone Health Network for the information shared in this video. If you'd like to stay in the loop, follow PATH, Parent to Parent Family Voices of Connecticut on Facebook, where you'll get updates on future episodes and other programs. Thank you.